Good afternoon, everybody. Welcome to this presentation of the Family Cafe. It's called the ABCs of Family Professional Partnerships and the Florida Family Leader Network. My name is Angela Miney and I am the family partner at the University of Florida Pediatric Pulmonary Training Center. Originally, if we were in Florida for this, Linda Starnes, who's a family leader at the Florida Department of Health Children's Medical Services, would be joining me. But for now, it's just me that you're getting. But I appreciate you taking the time and having the interest to listen to this presentation. My goal for today is to encourage you to join the Florida Family Leader Network, commonly referred to now as the FFLN. And the FFLN is trying really hard to be a force for change within the state of Florida as we try and improve the services that we give to our children with special healthcare needs. So whether we describe them as children with medical fragility, medical complexity, a disability, the umbrella term is children with special healthcare needs, and the FFLN is working hard to improve services for them. So let me just start with the ABCs of family professional partnerships. It really, for me, started with advocating for my own daughter. She was diagnosed when she was 6 with what turned out to be a very complicated chronic health condition. And thankfully, she got really good care at UF Health, and a couple of years ago transitioned her care to adult services and now is largely responsible for taking care of herself. But when she was first diagnosed, I had no idea really how to navigate the healthcare system, but I really wanted the best care for her. And so I became her advocate. And through that, I had the opportunity several years ago to be invited by a group at UF Health, the Pediatric Pulmonary Center, to become a family leader. And what that meant was they asked me to just come and share my experiences as somebody who was experiencing healthcare with her child at UF Health, and to share that with the healthcare providers within pediatric pulmonary, but also with the next generation of emerging professionals that they were training to take on medicine as we go forward. And so really what we started was a collaboration, and it's why I like to refer to myself as a family partner, because I really enjoy or think that it's more about partnership than anything else. I don't have the answers to everything. I think that it's important that we work together. And when I talk about we, I'm talking in my case with the other providers at UF Health and other partners then that I have within the state, but that if we all work together, that we can bring about change and improvements for our children with special healthcare needs. And so that's really what the underlying goal of the Florida Family Leader Network is to bring about that change. So let me tell you a little bit about who family leaders, family partners are, about the FFLN, when we got started, and where the FFLN is going. And really what I want to do is to, I hope, encourage you through this presentation to be interested in reaching out to me, whether you feel you are currently a family leader, whether you are an aspiring family leader, or I even spark a modicum of interest in you, or perhaps you are a professional and you know people that you feel would make an impact, but you've never really been able to direct them to the proper channels, I suppose, or the proper networks where they would be able to do their best work. And so hopefully I'll be able to provide some of that for you. So when I talk about family slash youth leaders or partners, and I want to go back to just the notion of youth leaders and tell you that obviously they are also really important, because as they age and become young adults, they then become responsible for their own care. And really, what we want them to do is, if they have the time and the interest, to also advocate on behalf of others, not just on themselves. So, when we talk about family youth leaders and partners, we're talking about people who have gained knowledge and skills from taking care of themselves or their own children to now using those skills and the traits that they feel they have inherently within themselves to work on behalf of others. And there is quite a big body of people within the state of Florida who are working as family youth leaders. We have about, I think, 100 or maybe 120 family leaders within the Florida Family Leader Network at the moment, and I know for sure that there are others out there as well. When I talk about champions, I'm really talking about the professionals who support us in this work. And again, in terms of partnership, I don't believe that we can be as effective working on our own, and I think it's really important to collaborate with people in institutions who are in a position of leadership to be able to affect the change in those organizations. And of course, as I mentioned earlier, we are also engaged in, as family leaders, in educating emerging professionals, but we really rely on them to carry on our work and to be supportive of our work as they move forward. This and the next slide are busy slides, but I actually think that they are really important. And I've also considered, I've often considered making handouts of them, or putting them on laminated pieces of paper, because the information on this on the next slide really emerged from a meeting back in 2016, I believe, where a group of family leaders and champions and emerging professionals came together, and we talked about this concept of family leadership and how we could be better family professional partners in bringing about systems change. And at that meeting, we asked everybody at the meeting, not just family leaders, but champions as well, what the traits were that people felt family leaders brought to the table. So, not everybody feels that they want to be or can be a family leader, but most of us who were there felt that there were things that we kind of had within ourselves that enabled us to be family leaders. So, for example, being open-minded, being willing to work with professionals, not coming with an agenda, having a certain amount of emotional maturity, I suppose. And we really felt that, family leaders do have those, for the most part, have those traits. And they are also very passionate about the work that they do. And so you can take these, you can read these, you can look within yourself and identify the traits that you have that maybe are listed here. Maybe you've never thought about yourself as being a family leader, but let me tell you, if you have a child with a special healthcare need, you are definitely an advocate, and you are working to get the best for your child. And so I would ask you to think about doing that for others as well. And then on this slide, what we identified were the things that we felt we needed to know to be successful. So, for example, the medical community has all of its own language. We have all of our own acronyms. Most organizations have acronyms that it's almost like our secret language. But to be effective family leaders, we felt that what we needed to know was what the goals were for the organization that we were working in, so that we could partner and work together. And of course, being part of a network or being part of a professional Discipline is also really important so that we can share resources and best practices and work together. So let me talk for a few minutes about family leaders, and I will include youth leaders in that definition as well, but how we are engaged as partners in the care of our children with special healthcare needs. So again, these are a couple of busy slides coming up, but they are just to give you an idea of where family leaders are looking. So at the local level, for example, at UF Health, I am on both the Pediatric and Adult Advisory Council. We have several other FFLN members on those councils as well. And what we do on those is to try and help the organization serve our patients and families better and to give them a better experience of our organization. Many people serve on committees where they are working on a particular project, for example, or they are on committees for a certain length of time. And for example, I serve also on the board quality committee at UF Health, where again, I give input as a patient and a family member experiencing healthcare at the organization. We also, family leaders are also involved in educating the emerging professionals. Many organizations have mentoring programs where a seasoned family leader within, for example, a particular disease group will mentor a family who are new to a particular illness and who need support in navigating the system. And then in my own case, and in many cases within the state also, there are paid family leadership positions where we work alongside our providers as part of the workforce. At the state level, Children's Medical Services does not do anything anymore without involving patients and families on their needs assessment, their strategic vision groups, their work groups, their focus groups. The Florida Family Leader, the Florida Network on Disability, of course, is the Family Voices chapter within the state of Florida. They do wonderful training and education for families with disabilities and medical fragility, and many of their staff positions are staffed by people who have children with disabilities or medical fragility. This organization, of course, Family Cafe, has been amazing over the past 20 years in creating that space for dialogue and for promoting and enabling us to be better advocates for our children, youth, and now, of course, adult with special needs. And then there is just general advocacy that happens throughout the state, and people like Partners in Policy Making have helped to educate us to be better advocates for our children and our adults with developmental challenges. And then I just listed some of the organizations here at the national level who have been responsible for developing best practices, who have promoted family professional partnerships nationally, and have been instrumental in really bringing that conversation to every state within the country and really encouraging healthcare agencies, community partners, and within education to allow the patient and family or the consumer voice to be heard. So let me just tell you a little bit about the Florida Family Leader Network and hopefully encourage you to join us. So our mission is a pretty broad one. We really want to just work with professionals and emerging professionals to collaborate to bring person-centered care to our children with special healthcare needs. Our primary goal is to break down the silos that we see, particularly in healthcare, but then in community partnerships as well. And, you know, I've experienced it as a parent with a child, I'm sure you have too, where you see lots of community agencies in healthcare and education where everybody is doing great work for our child, but sometimes there could just be better coordination between them. And family leaders are in the perfect place to affect that change, because you are the ones with the child that we're trying to help. And so we are sort of the linchpin that bring all these systems together, and therefore we can help to break down those silos. This is just a visual of where family leaders are members of our FFLN are throughout the state. And as you can see, we are pretty much scattered throughout the state, and I would love to invite you to join our network, and then we can include you on this map as well. This just gives you a visual of the organizations that have sent representatives to the FFLN summits that we have held both in 2018 and in 2019. And as you can see, I wanted to highlight that the children's hospitals within the state are also very supportive of what we are doing. And, you know, it's really important for them to collaborate together so that we can ensure that there are best practices and standards of care throughout the state. And then also for them to work with the community agencies that are serving our children with special healthcare needs. The FFLN, primarily what we are is a networking organization, and what we want to do is to bring family leaders, our champions, and our emerging professionals who are interested in the work that we're doing, to bring us all together so that we can network with one another and bring about effective change. And as part of that, we also want to develop ourselves as leaders, but then we also want to develop people who are aspiring to be family partners. And, you know, if you haven't thought about it before, I would encourage you to think about it. And as I said, to think back to some of those traits that I talked about earlier, and think about whether you would have time now within the parameters of what we're asking you to do already, because I know if you have a child with special healthcare need, that puts an added burden on you, but it's very rewarding work to be part of a network. And we do offer leadership training, and most of our trainings are free. In fact, everything that we have been able to do so far has been free. So how we connect with one another are through our annual summits, where we do leadership training and development. And outside of our summits, we also offer webinars throughout the year, which we also record and are available for you to listen to if you're interested. And then we facilitate networking and foster collaboration. We have an executive committee that meets every other month and works to guide the FFLN in its development. And for the moment, our primary way of publicizing ourselves is through a Facebook group, and we offer local and national resources there. The members just share resources that they've come across that are very up to date. We foster statewide, nationwide, but also local networking. We are championing advocacy efforts, and very occasionally on our Facebook group, we also are able to post some employment opportunities that may be of interest to people. Currently, we are in the process of developing a website for the FFLN, which will be available later in June 2020. We've also had the privilege of presenting at some national conferences, Family Voices, the Association of University Centres on Disability, Family Cafe, and the Association of Maternal and Child Health Programs, where we have been able to present the work that we have done about the Florida Family Leader Network and present it as a model for other states. So just my final thought is, you know, family leaders just see healthcare through a different lens. We don't have all the answers, which is why I like to emphasize that we are interested in partnering in the care for our children, and that we want to work alongside professionals and champions so that we can get the best care possible for our children. this work can be very hard, it can be very frustrating, but like anything that's hard and frustrating, when it's successful, it can be very enjoyable. And I really do think that just having a network of people to reach out to and to share challenges with has certainly been a great experience for me as the coordinator for many. I've been doing this work since about 2006 now, located in Gainesville, which is, you know, a small town. And I really was beginning to feel pretty isolated in this realm of family leadership. And it has been so wonderful to reach out to others in the state and find that there are other people who are doing work similar to mine. So if you have any interest at all, I would encourage you to contact me. Again, my name is Angela Miney, and I am at aminey@peeds.ufl.edu. There will also be a handout going along with this presentation with my contact information on it as well. But if you even remember my name and Google it, and you'll find me at UF Health. And I would really encourage you to reach out. I would love to tell you more about the FFLN and invite you to be part of the conversation. And thank you so much for taking the time to listen today.